A very pleasant and safe day to everyone. Together with my co-authors, Engineer Jed Emil Chiwa and Dr. Mers Tumibay, I am Dr. Rosula Reyes, and I will present to you our study, Gamification of Balance Exercises with Intervention Techniques and Feedback System using Intervention, Motivation, and Game Design Analysis, a preclinical study. This study was a collaborative effort between the Ateneo de Manila University and the Philippine Orthopedic Center. My presentation flow includes the following: the abstract, the objectives, design framework, methodology, results, conclusion, and recommendation. For the abstract, this study presents an automated balance board developed to conduct the static and dynamic balance exercises to post-stroke and post-injury patients. The team also developed a gamified environment for ensuring motivation while such exercises are conducted. The objectives of the study include create an intervention means for balance challenge post-stroke and post-injury patients using sustainable automated techniques. Facilitate a motivating and engaging means of therapy for balance challenge stroke patients using gamification. Creation of a feedback system to use the game for assessment of rehabilitation progress of balance challenge stroke patients, and the study of the correlation between game elements and feedback system. This is the design framework. It includes the study phase and the implementation phase. A feedback system has been included to provide a means of modifying the system. The output of the system is correlated based from the data taken from the feedback system. The system is composed of two main parts, the hardware and the software system. The hardware part is composed of the balanced board and a microcontroller. The angle iteration can be set to 0, 5, 10, 15, and 20 degrees. We set the maximum at 20 based on a study from the Philippine Orthopedic Center. A healthy individual can withstand without toppling off is at 16 degrees. The software part is a seafaring game in which a boat is controlled by the movement of the balance board. The in-game settings can be configured using 5 settings: duration, intensity, bias limits, and assistance. So these are the game modes: collect the crates, avoid the bumps, and follow the light. This table shows the software implementation of the game modes. The player input for collect the crates is a lateral dynamic balance exercise. The player must be able to challenge himself or herself, a postural sway and recover from it as much as possible using lateral movements. In avoid the bumps mode, it is for static balance exercise. Player must be able to stand still as much as possible to avoid the bumps. And for the third mode, follow the light. It's a posterior anterior dynamic balance exercise. The player must be able to challenge himself or herself, postural sway, and recover from it as much as possible using posterior and anterior movements. The equilibrium score is used for scoring standard. It's based on the chance of fall, where 0 is the most chance and 0 is the least chance. So this is based on the maximum displacement of postural sway. This table shows the game matrix format. For tracking play sessions, the game matrix is implemented using a simple through .text format. It publishes the patient's name, the time the exercise is completed, the quest played, their in-game score, the ES, the maximum posterior anterior sway, and the maximum lateral sway. For the preclinical test, for this design and usability of initial clinical issues, we did performance tests for hardware and software performance upon usage, behavioral tests for checking test subjects' affective states, postural tests for checking test subjects' postural position upon using the device. Other metrics were also done for system usability scale, intrinsic motivational inventory, game review survey, and debriefing interview. Data collection was done for intervention analysis and motivation analysis. Intervention analysis contains all of the results from the balance exercises and questionnaire. For the motivation analysis, measures the amount of motivation each test subject has based on a metered scale from the intrinsic motivation inventory, behavioral metrics, and self-rated tests. The objective of the correlation analysis is to find the correlation factor R in order to draw out relationships. For R greater than 0.5 but less than 1 is good correlation. For R greater than 0.3 but less than 0.5 is weak or little correlation. And for R greater than 0 but less than 0.3 is no correlation. The game metrics is implemented into a simple .text file, which is responsible for collecting the name of the patient, the in-game score, ES score, maximum posterior anterior sway, and maximum lateral sway. This is the metric success indicator. For the metrics ratings, we have from poor or very unsuccessful to excellent or very successful with values of 0 to 4.55% and 95.46 to 100% respectively. For the SUS score, also shows from the lowest score of 0 to 50 as poor and highest score of 86 to 100 for excellent. For the demographics, there were 18 test subjects with age bracket 23 to 26, 8 male, 10 female. From the age bracket, no one got stroke, no one had injury 6 months prior, although one got injury 9 months prior. Still on the demographics, 100% had good balance condition, heart, hearing, grip, and speech. 44.44% good eyesight condition, and 55.55% needs eyeglasses. 100% is good. 4 had tried using a balanced board before, and 14 haven't. 17 out of 18 had prior knowledge of video games. 15 out of 18 had tried motion-controlled games before. Out of that 15, 14 claimed that motion-controlled games are easy to use. As to the game matrix, Collect the Crates has an average score of 23.61 and an average ES of 87.503. For Avoid the Bumps, we have an average bumps hit of 1.67 and an average ES of 96.12. Still on the game metrics, Follow the Light, we have an average ES of 95.79. For Trial 2, we have an average ES of 96.67. Trial 3, average ES of 97.69. Overall average of 96.71. For the intervention analysis study, we did performance metrics, to test whether the device works properly under test subjects' use. We have 4 categories. A, user is successful in doing the task without much assistance. B, user is successful in doing the task with assistance. C, user is unsuccessful in doing the task because of technical issues. D, user is unsuccessful in doing the task because of the choice of the user to drop the task or no opportunity in doing the task. This graph shows that we have A, 190 or 87.99%. The performance success rate is 91.67%. For the intervention analysis on postural metrics is a test whether the test subjects would have proper posture all throughout the game test. We have 4 categories: A for perfect, B condition, C compensatory, and D top over. This graph shows that out of 18 test subjects, we have B as the highest, or a postural quality rate equivalent to 65.8%. On the game self-evaluation, the analysis shows that the balanced board usage is satisfactory with a rating of 70%. The game usage is good with a rating of 82%. On the intervention correlation analysis, this table shows the correlation factor for all the tests that were performed on the different game modes with respect to the game and the board manipulability. We can see here that the performance success rate versus the postural quality rate has a correlation equal to 0 or no correlation. On the motivation analysis, the intrinsic motivational inventory test to show whether test subjects have motivation on performing these tasks. There were 22 items surveyed and a rating from 1 to 7. So the subscale shows interest or enjoyment, perceived competence, perceived choice, and pressure tension. On the motivation analysis, intrinsic motivation inventory, it is shown here that interest enjoyment score has an average of 39.78, perceived competence of an average 25.33, perceived choice with an average of 29.22, and pressure or tension with an average of 17.5, which shows that there was interest and enjoyment in this motivation analysis. Motivation analysis on the behavioral metrics is a test to test subjects appear to have felt during the test. So these are affective states like boredom, delight, confusion, engaged concentration, frustration, and surprise. The data shows that the behavioral metrics has interest and enjoyment as the highest rated data. On the motivation analysis, game walkthrough evaluation, this scores out of 10 points to check on aesthetics, content control, gameplay, rewards, and stability. Overall, we have an average of 7.49, although it can be seen that controls has the highest rating. On the motivation correlation analysis, we can see the behavior observations score and no correlation in terms of the behavioral observation score versus the SUS score on game concept and design measure. It can also be seen actually that there are several instances wherein there is no correlation between this motivation. So these are the other combinations. In conclusion, the device is successful with a rating of 91.67%. There were issues that were pointed out in the hardware, the connectivity of each module that causes disconnection. The board is too loose upon stepping on the board the first time. The board is hard to control during the collect the crates quest. On the game, there was no sound, not very responsive, evident glitches. On the test procedure, the instructions are not much clear whether to play the game with or without the test subject holding on the rail. On the intervention analysis, improvement of balance quality is yet to be conclusive. The usefulness of the hardware and game are okay. The adjustments in test procedure on the postural metrics monitor the posture of the patient. For motivation in performing balance rehabilitation, playing a game is a good motivating factor in performing and redoing balance exercises. Game concept, design, and comprehensibility are good improvements on game elements as it is important in aesthetics, bugs, glitches, and difficulty. These are our references, and thank you very much for your kind attention.